You know, in the world of modern medicine, some tools are just so reliable, so effective, they become the absolute go-to. Today, we're diving into one of those cornerstones, an antibiotic called Ceftriaxone. This isn't just any drug. It's one of the most trusted weapons doctors have in the daily fight against serious bacterial infections. So, let's break down what makes it such a workhorse.
So, what is it that takes a drug from just being an option on the shelf to being a doctor's first-line choice? That's the big question we're going to answer by looking at what makes ceftriaxone so incredibly indispensable.
Okay, first up, let's talk about what it actually is. Ceftriaxone is what's known as a third-generation cephalosporin. Now, that might sound technical, but all it really means is that it represented a huge leap forward in antibiotic technology. Think of it as a more advanced, more targeted weapon designed to take on a wider and tougher range of bacterial enemies.
So we've got this powerful tool, right? But how does it actually get the job done? Let's get down to its core mission, taking out bacteria at the microscopic level. And I want to be clear, we're not just talking about slowing them down. We're talking about a complete and total takedown.
And that brings us to a really important word, bacticidal. Ceftriaxone is designed for lethal force. It doesn't just put bacteria on pause or stop them from multiplying. No, its entire job is to actively kill them, and it is remarkably good at it.
So think of this as a four-step special ops mission. First, target acquired. Ceftriaxone zeroes in on these specific proteins inside the bacterial cell wall and latches on. Step 2 is sabotage. It completely blocks the construction process, so the bacteria can't build or repair its own armor. This leads directly to Step 3, weakened defenses. The cell wall just starts to fall apart. And finally, Step 4, structural failure. The cell can't handle its own internal pressure, it swells up, and boom, it literally bursts. Mission accomplished.
A weapon is only as good as its targeting system, right? Knowing how it kills is one thing, but knowing what it kills, well, that's what makes it a clinical powerhouse. So let's look at the specific missions ceftriaxone is built for.
Okay, so here's the breakdown of its strength. Its main specialty, where it really excels, is fighting what we call gram-negative bacteria. These are tough customers like E. coli, Klebsiella, and Neisseria, the bug that causes gonorrhea. On the other side, while it's a little less potent against gram-positive bacteria, it's still very reliable against common culprits like Streptococcus pneumoniae, a major cause of pneumonia.
So what does all that mean for patients in the real world? It means ceftriaxone is the go-to for a really wide range of serious conditions. I mean, we're talking about life-threatening infections like bacterial meningitis and sepsis, widespread issues like pneumonia and complicated UTIs, and even specific diseases like gonorrhea and the later stages of Lyme disease. It is a truly versatile drug.
All right, so we've seen what the drug does to bacteria. Now let's kind of flip the script and look at what our body does to the drug. Because this is where ceftriaxone has some really unique advantages that make it so incredibly convenient to use.
First things first, you can't take ceftriaxone as a pill. It just doesn't get absorbed through your stomach. So to make sure it works, it has to be given directly into the body, either through an IV line straight into a vein or as an injection deep into a muscle.
Now this number right here, 6 to 9 hours, this is the secret sauce. This is the drug's half-life, which is how long it takes for your body to get rid of half of it. And for this type of antibiotic, 6 to 9 hours is an exceptionally long time. This is the key to its biggest practical advantage.
And why does that long half-life matter so much? Because for many really serious infections, it means patients often only need one single dose a day. And that is a huge deal. It's way more convenient for patients, it simplifies everything for nurses in the hospital, and it even makes it possible to treat people at home who might otherwise have to be admitted.
And here's another really unique feature, how the body clears it out. Ceftriaxone has a dual elimination pathway. About 60% gets filtered out by the kidneys, and the other 40% is handled by the liver. It's like having two different exit doors instead of just one.
And the payoff for that is massive. Because the body has two ways to clear the drug. If one organ isn't working at 100%, say a patient has some kidney problems, the liver can just pick up the slack. This makes the drug incredibly reliable and forgiving, and it means doctors rarely have to make complicated dose adjustments.
Of course, no powerful weapon comes without risks. We've talked about its incredible strengths, but to really understand this drug, we have to talk about the other side of the coin, the safety profile, the side effects, and some critical warnings that you absolutely have to respect.
Now, for the most part, ceftriaxone is tolerated pretty well. The usual suspects for side effects are things like pain where you got the shot, maybe some diarrhea or a rash. It can also cause something called biliary sludging, which can kind of feel like gallstones, but the good news is it's usually reversible once the drug is stopped.
But there is one warning that is an absolute, non-negotiable rule. Our source material puts it bluntly, calling it a critical and potentially fatal interaction, which tells you just how serious this next point is.
And here it is, the big one. You never ever mix ceftriaxone with an IV solution that contains calcium. If you do, they can literally form solid particles, like tiny crystals, in the bloodstream. And those can get lodged in the lungs and kidneys, and that can be absolutely catastrophic.
This rule is ironclad for every single patient, but it is especially strict for the most vulnerable among us, newborns. In babies under 28 days old, this combination is an absolute no-go, period. It's a black and white rule designed to prevent a terrible outcome.
So when you put it all together, its potent killing power, its broad range of targets, that incredibly convenient once-a-day dosing, and its reliable performance even in complex patients, it is crystal clear why ceftriaxone is a true cornerstone of modern infectious disease treatment.
But its very success brings up a pressing and kind of scary question for the future. We lean so heavily on these workhorse antibiotics, but bacteria are smart. They are constantly evolving and developing resistance. So the question is, how long will amazing frontline defenders like this one actually hold up? It's a crucial thought, because the race between our medicine and the microbes, well, that race never truly ends.